Good afternoon once again. Today is Monday, the 5th of April, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA, once again. So just now, thank you to Dr. Apisamai, or Dr. Bird, for the Thai language edition of the summary. This morning we had the daily CCSA meeting as usual on many important issues, and I'll go to that. Firstly, the numbers that we have for today, the cases that we have recorded for today. New cases is 194, wherein of that number, 182 cases are from local transmission. The accumulated number of cases we have so far since last year is now 29,321, with the active cases being 1,386, as you can see on screen now. Active cases still being treated in the various medical facilities. We have no new fatalities recorded for today. The accumulated number of fatalities now stands at 95. Now, as Dr. Apisamai had stressed, the recent situation right now indicates that there are new infections increasingly found in crowded places around the country, in clusters, small clusters. Mostly in entertainment venues. You might have seen in the news, entertainment venues, which the authorities will have to keep a close watch, and I'll go to that for the reason behind that. Now, it was reported that new cases were traceable. The most recent new cases were traceable to entertainment venues in several provinces, not only in Bangkok, but in Bangkok, and also in Nakhon Pathom, in Pathum Thani, and Nonthaburi as well. Now, authorities will have to step up their close watch because of the impending risks. Usually, entertainment venues, as we all know, would have some sort of an issue with the airflow, the air circulation within the venue, as well as low ceilings, and a lot of interaction and conversations between the patrons. And of course, people go, speaking in layman's terms, go bar hopping. So they visit various venues in one night. So therefore, entertainment venues in Thailand, in Bangkok, are venues which are of high risk. Authorities would now have to be much more vigilant in terms of keeping a close watch on the various entertainment venues. We've seen a lot of numbers of positive cases come from these entertainment venues in the past days and weeks. In addition, also at the same time, a cluster was also found among officers and inmates of a prison in Narathiwat province. Also, in Bangkok, it was reported that several international schools have taken precautionary measures by closing their campus for a few days after it was found that parents of the students in some of these schools had contracted the virus, or there were transmissions within the school neighborhood. So that's a good precautionary measures. There were a lot of notices going around for the parents of the many international schools and expat community in Bangkok on this issue. The risk factors of all of these clusters, all of these cases, include staying in crowded and enclosed areas where air does not ventilate very well, and not wearing masks and not keeping a physical distance. So therefore, we have to remain vigilant in terms of the measures that we have. And to prevent any further possible transmission in entertainment venues, the CCSA is considering to temporarily close for 2 weeks such places if any of the entertainment venues found any COVID positive cases. And on provincial, in the provinces, you may have heard that we've been announcing the new quarantine, reduction of the days for the quarantine for those traveling in from various countries around the world, from 14 to 10 days, except for those who travel from countries which have the variant strain, which was announced already. some 11 countries from African countries. And in Phuket in particular, in some provinces in particular, since the 1st of April 2021, foreign tourists who have been vaccinated can travel to 6 pilot destinations and will be quarantined at the hotel for a reduced period of only 7 days. These destinations, as I mentioned, the Phuket, and aside from Phuket, Krabi, Phang Nga, Chonburi, Chiang Mai, and Samui. So this is a part of our efforts to open up the country gradually, when and where appropriate, and to revitalize the tourism sector. So it is planned that after this year, on the 1st of January 2022, early next year, all foreign tourists who have received the vaccine will be able to visit Thailand without any quarantine requirement. And talk about vaccines, from the end of February, the 28th of February, until the 4th of April 2021, yesterday, the Ministry of Public Health has inoculated 257,484 doses of vaccines to date, 257K. And out of this number, 213,948 people were given their first dose, while over 43,000 have received the second dose already in Thailand. The Ministry of Public Health is also preparing to allocate over 783,000 doses of Sinovac vaccines to 85,000 doses, and this will be AstraZeneca vaccines, to hospitals around the country. The vaccine inoculation process is ongoing. The public should remain vigilant and follow the DMHTT measures. Dr. Apisamai had mentioned we have a plus there, so it's DMHTT plus actually. Distancing, mask wearing, hand washing, temperature checking, testing for COVID for those found to be at risk, and for the use of the applications involved. So actually it's DMHTT plus or DMHTTA. So even for those who have been vaccinated, it is recommended that you still wear masks, and I think this is an issue that we have to remind from time to time. There have been reports of some people who have been vaccinated and they feel that they do not have to wear the mask anymore. That is something that we would be talking against. It's still recommended that you wear masks and avoid any chances of unknowingly transmitting the virus to others, even if you are among the 43,000 people who have received the second dose of vaccine, or among the 213K people in Thailand who have received the first dose of the vaccine. This is because although the vaccine can prevent sickness and the infection from COVID, it's still possible that the vaccinated person can carry enough virus to infect someone else through different forms of transmission, like coughing. And all of these control measures will be very critical during the Songkran period, since many people will be traveling to other provinces and are likely to have gatherings with family members and friends. And on screen, we have a couple of slides, infographics from courtesy of the credit to the World Health Organization on this issue. So a question was asked, of course, about Songkran, and that's very important that we keep our guard up during Songkran. It's important that we celebrate it in a traditional way and not in a party mode kind of way that we usually have every year. And we've talked about that quite often on how to celebrate Songkran best and how to celebrate Songkran in the safest way possible. So just in closing, I'd like to mention just about enforcement. Now that's very important. You realize that we have an emergency decree in this regard in Thailand to prevent COVID, so that the authorities will be able to control and act accordingly to prevent COVID. Now, just to reiterate that authorities have the officials have the authority to inspect and even close down certain business establishments that if they are found to be violating the various measures. And they have this authority by law, Article 9 of the emergency decree. So that's very important for us to for business establishments also to be aware of the importance, of the seriousness of being in line with the various measures that have been put in place, and not to violate the various measures which will be harmful to the society as a whole. So this is the information that I have, that I've recapped from the Thai language version. You can find more information on social media, and we'll see you again next time. Thank you very much for your attention. Sawasdee krap.